Today we're going to talk about hepatocellular carcinoma. Definition: hepatocellular carcinoma, or HCC, is a primary malignancy of the liver and occurs predominantly in patients with underlying chronic liver disease and cirrhosis. The cells of origin are believed to be the hepatic stem cells, although these remain as a subject of investigation. Tumor progress will local expansion, intrahepatic spread, and distant metastasis. Now it is the third leading cause of cancer deaths worldwide, with over 500,000 people affected. The incidence of HCC is highest in Asia and Africa, where the endemic high prevalence of hepatitis B and hepatitis C is strongly predisposing to the development of chronic liver disease and subsequent development of HCC.
We've added new content to a recent webcast. Watch doctors from the Center for Liver Disease and Transplantation of New York Presbyterian present their research findings on the diagnosis, treatment, and survival rates of hepatocellular carcinoma. Hepatocellular carcinoma, or HCC, is the most common form of primary liver cancer. It accounts for about 80 to 90% of new liver cancer cases, and there are about 21,400 new cases diagnosed each year in the U.S. For unknown reasons, the disease is more common in men than women, and a typical patient is around 65 and has had cirrhosis for a decade or more. We've got an update with new information from this previously
In 1981, after Beasley linked hepatitis B virus infection to HCC development, the cause of HCC was thought to have been identified. However, subsequent studies failed to identify HBV infection as a major independent risk factor, and it became apparent that most causes of HCC develop in patients with underlying cirrhotic liver disease of various etiologies, including patients with negative markers of HBV infections and who were found to have HBV DNA integrated to their hepatocyte genome. Inflammation, necrosis, fibrosis, and ongoing regeneration characterize the cirrhotic liver and contribute to HCC development. In patients with ABV, in whom HCC can develop in livers that are not friendly cirrhotic, underlying fibrosis is usually present, with the suggestion of regeneration. By contrast, in patients with hepatitis C virus, HCC is barely present, more or less in the setting of cirrhosis.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the third most common cancer in the world and one of the leading causes of cancer deaths. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patients. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall.
Pros and cons. Pros. Viral hepatitis B and or C, aflatoxin, and alcohol are major risk factors of ACC. However, the importance of these different factors varies in different geographic areas. Hepatitis B carriers have more of a 10% to 25% lifetime risk of developing ACC. Unlike other causes of chronic hepatitis, HBV is unique in that ACC can develop without evidence of cirrhosis. Genotype C has been associated with a higher risk of HCC than genotypes H, B, and D. In addition to this, in China, HBV and ACC, aflatoxin, and contamination of drinking water, such as a promoter of hepatocarcinogenesis, remain as major risk factors of ACC. Also, alcohol consumption and cigarette smoking are another risk factors. The relationship between alcohol and liver disease correlates with the amount of alcohol consumed over a lifetime, diabetes, and obesity too. Cons: hypoglycemia and hypercalcemia. It occurs in less than 10% of patients. It is believed to occur by synthesis of erythropoietin by the tumor. Hypercalcemia, in the absence of bone metastasis, can manifest with dizziness and lethargy or stupor. It is attributed to the secretion by the tumor of a protein related to parathyroid hormone.
Hepatocellular carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis, for example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Features: tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease.
Issue applied in Ecuador. Hepatocellular carcinoma is a prevalent disease in Ecuador, with a high rate of healthcare costs and mortality. It isn't available yet some private or public program that allows a patient with cirrhosis access to a transplant.
Here is another liver. In the southeast, we could see large nodules of liver, perhaps a macronodular type of cirrhosis, in which you could recognize that we still can basically make out liver cords, but they are separated by bands of dense fibrous connective tissue that gives them a very, very nodular pattern. Let's
Conclusion: primary liver cancer is the third most common tumor around the world. Hepatocellular carcinoma occurs mainly in the context of cirrhosis, hepatitis B or C, or non-alcoholic steatohepatitis. Underlying liver disease limits therapeutic efficacy. Most people do not have any noticeable symptoms associated with hepatocellular carcinoma. They may have symptoms related to liver cirrhosis that may have become more difficult to control.
HCC is called the silent killer. The impact is really not the patient himself. All the families are affected.
为在中国呢，有100万人是乙肝病毒携带者。
Hepatitis B carrier status and hepatitis C carrier status are really the predominant risk factors of HCC, which cause inflammation and cirrhosis. With the advent of hepatitis B vaccination programs in childhood, we expect that to drop, and it has already in many Asian countries. Today, the world has changed phenomenally. The new risk factor that's a concern to everybody is fatty liver, and a lot of that can be attributed to a modern urban diet.
Now we have very high prevalence of the obesity.